Hey, what's up? To treat heart failure, special treatments are sometimes used, such as implantation of a pacemaker, ICD, implantable automatic defibrillator, or CRT, cardiac resynchronization treatment. Other times, valve surgery, coronary artery bypass surgery, or even a heart transplant is needed. In either case, more than one drug is likely to be needed to keep the disease under control, so it's a good idea to know more about them. Let's see the 9 families of medications. What they do is prevent the body from creating angiotensin, which narrows blood vessels. This relaxes the blood vessels and thus lowers blood pressure. Thus the heart does not have to work so much, and the survival and prognosis of the disease are improved. Like any medicine, it has adverse effects. They can cause weakness, dizziness from low blood pressure, and a dry cough. They also sometimes cause skin rashes and, rarely, swelling of the lips or throat. But if that's the case, you have to tell the doctor right away. What recommendations should be taken into account with regard to ASI? Well, the next ones, blood pressure should be monitored frequently. It is preferable to take medication at bedtime in order to prevent dizziness due to a drop in blood pressure. If dizziness appears when he/she gets up, it is a good idea to move his/her feet back and forth, and to sit for a minute on the edge of the bed. For the same reasons, it is best to get up slowly from the squatting or sitting position. In the case of a dry cough, you should discuss with his/her doctor whether you can reduce the dose or switch to another medication. ARAs block angiotensin and relax blood vessels by lowering blood pressure. That is to say, they vasodilate like ASI but by another mechanism, so they are a good alternative for patients who do not tolerate them well. They have rare adverse effects similar to ASI, but unlike ASI, they do not cause irritative coughing. What should we recommend about ARAs? Well, as in the previous case, his/her blood pressure should be monitored often. The first dose should also be taken at bedtime, in order to prevent dizziness caused by a too pronounced drop in blood pressure. If he/she gets dizzy when he/she gets up, move his/her feet back and forth, and sit on the edge of the bed for a minute. It is best to sit up slowly from the crouching or sitting position so that the body adapts. They are very important in the treatment of heart failure, because they reduce the strain on the heart by lowering the heartbeat and blood pressure. This increases survival and improves prognosis. Symptoms may temporarily increase at first, so it is wise to start with low doses and increase them until the optimum is reached. Adverse effects. As the heart rate decreases, stress tolerance also decreases, which can lead to fatigue in the face of intense physical activity. These symptoms usually improve over months as the body's tolerance to the dose increases. They can also cause coldness in hands and feet. Sometimes it causes depression, and this needs to be discussed with the doctor. And the recommendations? Well, if after a few weeks there is still tiredness and dizziness, this must be reported in order to assess the dose. If he/she has asthma, it may get worse, so tell his/her doctor. If he/she has had breathing difficulties, beta blockers should not be abruptly discontinued. The doctor should be informed if the dose is lowered or if they are stopped. These medications remove excess water and salt from the body, so the heart won't have to move as much fluid, and you'll even be able to breathe better, as they relieve lung congestion. They reduce swelling of the lower limbs and weight. So even if the prognosis doesn't improve, the symptoms do. They can also lead to adverse effects, such as dizziness, muscle weakness, and cramps. Keep in mind that they are very powerful, and force us to go to the toilet about 1 hour after taking the diuretic. That's why we have to take it into account if we're going to leave home, or if we're going to sleep. It is advisable to weigh he/she frequently to check if he/she has lost too little or too much fluid. In this category are molecules derived from the digital, a plant, which strengthen the heart and reduce heart rate, especially useful for cases of atrial fibrillation, a common type of arrhythmia. Adverse effects may include loss of appetite, bad taste, nausea, vomiting, and even a distorted perception of colors, in which blue and yellow predominate. It is important to stick to the prescribed dose, because if it is excessive it can produce abnormal heart rhythms, palpitations, and even fainting, of which we must inform the doctor promptly. You have to learn to recognize the symptoms of poisoning, such as nausea, lack of appetite, or a very slow or fast pulse, and before a surgical intervention, you have to warn the surgeon. They dilate the blood vessels, especially the veins. This causes some stagnation, and decreases the volume of blood returning to the heart, improving blood flow and relieving blood pressure and its symptoms. They can be administered in tablets and in the form of patches, which must be removed to sleep in order to maintain their effectiveness. Within this family of drugs it is necessary to emphasize the nitroglycerine, of rapid action, that is administered as spray, or as tablet under the tongue, very effective to alleviate the pain of angina of chest. Adverse effects of nitrates. Dizziness when suddenly incorporated, by a change in blood pressure, headache, hot flushes or palpitations. As far as the recommendations are concerned, we refer to what was said with the ASI and ARAS, as they all lower blood pressure and can cause dizziness, with the consequent risk of falling and hip fracture. They prevent the formation and growth of blood clots by preventing blood from stopping and clotting where it should not. They are important for treating heart failure with atrial fibrillation because clots can form in the heart or blood vessels. The adverse effect is the tendency to bleed, which can manifest with bruises or hemorrhages. For this reason it is vital to stick to the dose and perform the prescribed analytical controls. In addition, the diet should be followed carefully, as certain foods modify the effect of anticoagulants. It is necessary to warn all the sanitary of the use of these medicines, the dentist, the pharmacist, and new doctor. Finally, the doctor should be informed of bruises that appear without blows, bleeding from the nose, from the gums, in the urine, or in the feces. The most common is aspirin, acetylsalicylic acid, which in low doses prevents blood clots from forming in the vessels or heart cavities. For some people, it causes irritation or even bleeding in the stomach, and rarely causes allergies. Since it can damage the stomach, it is recommended to take aspirin with meals. They are used to lower the amount of cholesterol in the blood. There is controversy about their use, since they can, at best, increase life expectancy by a few days, and it doesn't seem to be about reducing LDL, the bad cholesterol, and this, with adverse effects that can sometimes be significant, such as muscle pain. I leave in the description a study that supports this view, and questions the cholesterol hypothesis, as well as a link to a tool to assess the relevance of taking statins. In any case, most statins work for 6-8 hours, so it is usually prescribed at night, when the liver makes the most cholesterol. Well, so far for today. We will continue to abound in future videos on heart failure. Thank you very much.